The focus of this talk really is just about sort of families that we see or individuals that we see and why they're coming to see us and what are we doing with those families. And then we'll take that, we're going to go back to some basic science. All right, so what you see here is a pedigree. Are you all familiar with a pedigree? Have you heard that term before? Have you all done pedigrees in class? All right, so good. So this will be a little bit of a review for you, but this is a pretty typical family that someone who works as a cancer genetic counselor would see. So what you see here are some, squares and circles. So basically circles are used as a symbol to represent females. Squares are used as a symbol to represent males. Anybody with a shading has a specific condition that we're discussing. So in cancer, the shading will represent a specific form of cancer diagnosis. Anyone with a line through them, a slash through them, that indicates that that person has passed away. So some of the vital information that we as counselors need to get are, does this person have cancer? If so, what form of cancer? At what age were they diagnosed? And are they living? At what is their current age? If they've passed, what was the cause of their death? And at what age did they pass away? So those are some of the main things that we need to capture when we're seeing a patient. Normally, there would be an arrow that points towards an individual, and that arrow indicates that this person is what we call the proband. That means that that is the person who's come to genetic counseling. They're the person that has sought this information out, so they've initiated this process. They're what we refer to as the proband. So typically, an individual like this would show up in our office. So a 34-year-old female with a diagnosis of breast cancer, and maybe she's coming to genetic counseling because she wants to know what's caused her personal history of cancer or what's caused the history of cancer within the family. So what you can see here is that this woman has a mother, these two individuals here, so the lines up indicate parents. A line that connects two individuals indicates that those individuals are spouses of one of each other, or they have children together. So this woman's mother also had a breast cancer at the age of 48, which is relatively young, right? We consider 48 to be a young age. 34, like you all just said, is a young age to be diagnosed with a breast cancer. So this woman has a mother and a grandmother, both of whom have been diagnosed with a breast cancer. She also has a cousin who was diagnosed with an ovarian cancer. So these individuals across here are all of her aunts and uncles. So they're her mother's siblings, and these are her cousins. So we take a full history. This pedigree really is only focusing on the maternal lineage, but it's equally as important that we gather the information regarding the paternal, or her father's family history as well. So we get half of our genetics from our mother and half from our father, right? So we're an equal 50-50 blend of both of our parents. So it's equally important that when we're looking back at our own family histories, that we consider both mom's family and dad's family. We can't, just because some of these cancers tend to be more female cancers, like the breast cancers we're talking about, or ovarian cancer, it does not mean that we can't inherit one of these potential genetic defects from our father, even though they tend to be more female cancers. Typically when I see a patient, let's say that this was my patient, she came in, she may not know a lot about that aunt because that's not a blood relative of hers. So we don't necessarily gather that information, but if I were seeing this woman, I would definitely ask about that because that's her mother and her father, right? So sometimes that information is included, oftentimes that is included, it's just for sort of simplicity here, we've included just the people that are her blood relatives. So this indicates that this person does not have any children. And so that becomes important in particular. So cancer genetic counseling is just one form of genetic counseling. There's other types of genetic counselors. So genetic counselors can work in prenatal, so meaning a woman who's pregnant and is going to be having children or wants to have children and wants to know, do I carry some genetic mutations that I may be able to pass on to my kids. So in those instances, it's important for us to identify, has this woman had children? What's her history? Has she not been able to conceive? Has she had multiple miscarriages or pregnancies that never developed to a full-term child or birth? So in this instance, it just tells us that we did ask, and this woman does not have any children. And the reason that's important from cancer genetic counselor standpoint is because if we identify some kind of, bless you, some kind of genetic cause to the cancer in this family, it becomes very important to every member of this family. And so we want to make sure that we've accounted for every person in this family and that we're not overlooking anybody.